All right, so this is the discussion two for pathophysiology, in which I will be chatting about Eddie and his case. So, upon reading Eddie's case, most definitely more than one of his signs and symptoms or issues that he is experiencing are concerning. The ones that is of greatest concern to me are his circulatory and respiratory issues. So, given the situation and the statement that we were given, they're referring to Eddie. He's clearly having difficulty breathing, and with insufficient breaths, his blood isn't getting the oxygen it needs to perfuse his tissues. Which in a moment I'll go into more details of his specific signs and symptoms that indicate that. But yes, to me, his respiratory and circulatory issues, they kind of go hand in hand. So I would combat interventions for them together and simultaneously. So through investigating his signs and symptoms as well as his history, this appears to be leaning toward left-sided heart failure. However, as a nursing professional, that's not a diagnosis that it would be my place to make, but I can perform a lot of the assessments and get the background information that I could contribute to the healthcare team that could help to come to that diagnosis, so he can get a treatment plan in response to that. Just based on what we've learned in class, is kind of what makes it lean toward that left-sided heart failure. And some things that kind of go hand in hand with that, that indicate it greatly to me, is first his dyspnea and his shortness of breath, especially with exertion. So he mentions that when he gets up and goes to the bathroom, or when he's eating a meal or getting dressed, that's when he really notices his shortness of breath, and then fatigue follows afterwards. As well, orthopnea, which is mentioned when he shares his need to be nearly sitting up with multiple pillows in bed to avoid the shortness of breath. So we know that orthopnea is shortness of breath when in a certain position that usually resolves with a change in position. So that sitting up, having all those pillows behind him, helps to reduce that shortness of breath. Another symptom that we learned about in class is that that could be indicative of left-sided heart failure, or just proof that the heart isn't pumping the way it needs to be. Is that he's gaining weight. So it mentioned that he gained 5 pounds within a 1 week span, which could also, that goes right hand in hand with the edema and retaining fluid that we know that he's experiencing. As well, his vital signs upon admission also lean in the direction of his heart not working like it should be. So once again, that circulatory issue. And I mean, we know that the cardiovascular system and the respiratory system, they work cohesively. There's no point having one if you don't have the other. So with his vitals, we know that he's tachypnic. So his respiratory rate is 28 breaths per minute. His O2 stats are below normal ranges. So he only had a 90%. And we know that normally the average is between 95 and 100, 92 for hospitalized patients. But either way, he is below that range. So that indicates that his oxygen-rich blood isn't efficiently making it to his extremities. So whether that is due to a lack of oxygen in his blood or just a lack of circulation that's getting his oxygen or getting the blood to the extremities. As well, he's pale. He has audible crackles in both of his lungs and the lower lobes. He's anxious, restless. Most visibly noticeable is we know he's struggling with getting his shoes on due to the edema in his feet and ankles. And upon assessment of the edema, we determined that he has a pitting edema of a rated at 2 plus. And these are all things that we learned and discussed in class that can be telltale signs of the heart not functioning properly. And with that edema, I mean, that's indicative of blood's beginning to pool in the extremities. It's not having that return that it should. We also learned in class that certain illnesses or conditions can be contributors to developing some type of heart failure. And Eddie does have a few of those. So a myocardial infarction, also known as a heart attack, we know that he experienced one 2 years ago. He also has non-insulin dependent diabetes, which can be a contributor of heart failure, and a history of coronary artery disease as well, which, like I said, those are all things that we discussed in class, that can contribute to the development of heart failure. My main priority in providing care to Eddie is going to be getting him breathing more comfortably, as well as trying to ensure that his tissues are getting perfused and improving that circulation. Because I mean, for me, my priority when I would be helping a patient would be the ABCs to start off, which is our airway, breathing, and circulation. And like I said, I feel like there's not much point in having one if you don't have the other, kind of deal. So like I said, I would want to tackle his breathing and his circulation at the same time. So nursing interventions that I would provide for Eddie to help his circulation and, making that oxygen-rich blood is getting to extremities would be The first thing would be according to what we learned in class, as well as one of my references that I have a page included of Wayne G. So helping with repositioning and elevating edematous extremities, and those are going to help with venous blood return. We know his feet and ankles are edematous, so I would use probably a couple pillows, prop his feet up to prevent further pooling of blood and help that blood kind of return back. As well, according to the same resources that I just mentioned, Wayne G. Of Nurse Labs, assisting Eddie with range of motion exercises could also be helpful. Whether he's capable of doing them himself, so active range of motion, or passive active motion, or passive range of motion, or a combination of the two. So whether I assist him with them, or we get rehab in to assist him with them, or he can do those himself. And like I said, that's just to help with the venous return. I would also continue to assess the pitting edema and being mindful of CMST. So this is an assessment method that we've learned about greatly in other classes. So it's monitoring the color of the skin. If Eddie is able to move his extremities, being sure he still has sensation on those extremities and no altered sensations. So things like paresthesia, which we know is like the pins and needles, numbness or burning, as well as monitoring the temperature of the extremities. Um, and those are all things, like I said, that those are going to indicate on whether or not he has, like, that his tissues are being properly perfused and that he has arterial blood flow to those extremities. So that's something that I would continue to assess and just note any changes, improvement, anything like that. The first step to getting oxygen-rich blood to the extremities is doing everything that we can to improve his breathing, so his blood can efficiently become oxygenated. So once the blood is carrying oxygen, we just need to focus on getting that blood to his tissues, to his extremities. Um, so something that's not necessarily directly correlated to circulation, but related to his edema, as well if it's suspected that he does have heart failure. As nursing staff, something else that would be incredibly important that we're doing is monitoring his ins and outs, as well as his daily weigh-ins to see how much water he's retaining. Like I said, within that last week, he's already gained 5 pounds. So a big part of my nursing intervention for him would just be constantly assessing absolutely everything that I can. But like I said, my first concern to tackle is going to be that, getting his breathing good and as well as the circulation. So to aid with Eddie's breathing, some interventions that I would put in place would include something that we learn about in class is something as easy as raising the head of the bed to 45 degrees or into a semi-Fowler's position can make a big difference as it allows for better expansion of the lungs. We already know that Eddie lately has been sleeping with multiple pillows propping him up. So just being sure that he's never laying flat, that way he is able to, get like a good expansion of his lungs as he's laying in bed. Or the other thing as well, perhaps we can help him get into a chair during the day so he's sitting upright. And that way he only has to be in bed at nighttime. So whether he can get up and get to a chair by himself or we can help him there, that way at least in a chair, like I said, he's sitting upright and he's not just in bed all day. As well, through multiple of the classes that we've taken thus far, we've learned the extreme importance of staying mobile and moving as much as possible. So we already know that Eddie experiences dyspnea and shortness of breath with exertion. So being sure to never rush him, allow him to go at his own pace, offer ambulatory aids if needed to help him take some strain or effort off his body when he's trying to get around. We know that with shortness of breath can come dizziness, and with that, we could be increasing the risk for falls. So safety measures in place for Eddie as well, like I mentioned, the ambulatory aids or ensuring he has places that he can sit to rest or chairs like along his path in case he does become short of breath. Or perhaps, if we're assisting him walk, having a colleague be nearby with a wheelchair or something like that, just in case he does start to get short of breath. But like I said, I think has been ingrained in us in this program since day one, the importance of keeping mobile, because if you don't move it, you lose it. So just doing everything that we can to get Eddie up and out of bed, so long as it's safe for him to do so. Um, so I think that would be something that I would prioritize to help, like I said, help keep him active. Um, and that will help his breathing as well, getting up, and like I said, that good lung expansion. Although for any medications or for oxygen, we would need doctor's orders, so that's not something that we are going to assess and directly provide for him. But as we learned in pathophysiology, oxygen can often be used to assist with breathing with all the different um, disorders that we've discussed. So we as nursing staff, we can help manage that once it has been ordered for Eddie, if that is something that he ends up getting, as well as we can perhaps ensure the nasal cannula is positioned correctly, that it's set at the correct amount, of whatever rate is ordered, as well as we can continue to monitor his O2 sats for improvement. And that will also, his O2 sats are going to be a good indicator, along with all of his vitals, of whether our assessments and our interventions that we're making are being effective. As well, with any treatment or client, that we may have, anything that they're receiving, comes a lot of teaching. So something learned from an article pertaining to care with ineffective breathing by also Wayne G. He goes into some detail about different breathing techniques that help for better inhalation and expansion of the lungs. So, for example, teaching Eddie to breathe diaphragmatically, or belly breathing. So doing that can help, as well as teaching him to take, just tell him to take big, deep breaths, as big of breaths as he can, and just try to hold it for a couple seconds and then breathe out. And that way there's ample time for the alveoli to transfer oxygen to the blood before it's exhaled. Because we know the alveoli and the lungs are kind of toward the base almost. So if he's just taking very short breaths, I mean, it's not giving much time for that gas exchange to occur. So really just encourage him to take big, deep belly breaths. And, if you can hold it for a second or two, in that way, like I said, there's plenty of time for that gas exchange to occur. And that way, hopefully his blood cells are effectively kind of soaking in that oxygen and getting rid of the CO2. Overall, as mentioned, we as nursing staff cannot diagnose Eddie with heart failure. However, based on his signs and symptoms, I feel that's the direction that the physician would likely go, given the assessments that I would be performing and reporting to him, or reporting of Eddie. I do believe that the primary concern of breathing and circulation can be tackled simultaneously, as I've kind of outlined with the interventions that I would be providing for him. They're both really big concerns that most definitely need to be dealt with. And like I kind of already said, there's no sense of having really good circulation if you're not breathing. Like if you're not taking in any air, there's no oxygen to circulate. And then it's the same way the other way around. It's great to be breathing really good, but if your blood and oxygen aren't getting to the tissues, it's not really all that beneficial. So I think that those, clearly, with the edema and all that he's experiencing, it's clear. And the pale skin, that's cool to the touch, like it's clear to see that his circulation isn't the greatest. And then given the dyspnea and the crackles, he's obviously not breathing well. So like I said, I would tackle these concerns together, with the mentioned interventions above, that, and just continue to assess Eddie. I think that's one of the biggest nursing interventions with any care that we're providing, is that we're constantly assessing and evaluating our interventions to make sure that they're effective, and making changes along the way if it's clear that we're not getting the outcome or we're not seeing the improvement that we expect to see. So for Eddie, those are the interventions that I would follow. And like I said, I would be doing them together, because although it's great to be breathing, it's great to have circulation, if you don't have them together, um, it's not doing a whole lot of good for him. And like I said, just that constant evaluation. I mean, we know of the nursing process, that's our last step, and that can indicate to us whether or not our interventions need to be tweaked. So like I said, just constant evaluating of those interventions, and then hopefully we can get Eddie to a more comfortable state where he's breathing all right, and doesn't have so much discomfort and trouble getting around, getting his shoes on, that type of thing, reduce that edema. So, like I said, between just breathing and circulation, those are the above interventions that I would use in helping him.